The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism.
Ready or not, here they come. Full playgrounds, extracurriculars, assemblies back on, and no masks required. On Monday, schools in this province will be back to a normal they haven't seen since 2020. And tonight, we'll find out how kids and their parents are feeling about it. Then our Ontario Hub's editor, Sarah Trick, explains why she's not cheering the end of mask mandates. Also, the Agenda's Week in Review reflects on the 2-year anniversary of Ontario's first COVID-19 state of emergency. It's Friday, March 18th, and that's ahead on the agenda. 2 years ago, kids were just beginning an odyssey of disruption, virtual learning, masking, cohorting, and other restrictive school protocols. Monday, once everyone is back from March break, students will walk into schools and classrooms almost as they were before COVID-19. With us now for their thoughts on that very big change. In Malmore, Ontario, just north of Orangeville, Karen Brown, president of the Elementary Teachers Federation of Ontario. And in the provincial capital, Aya Ledera, parent and private school teacher. Tai Win, editor-in-chief of The Local. Hi, everybody.
Hi. Hello.
So I have 2 kids Monday who are going back to school. One child has said, yay, masks, never again. And one child is, I don't know. So it's great that we're having this conversation. Aya, let me start with you. As a middle school teacher and a parent of 2, what are some of your concerns on lifting mask mandates and other measures like cohorting?
So for myself as a middle school teacher, our school has maintained Rotary, and I am exposed to almost 90 students on a daily basis. So for me, removing my mask is a little scary in the sense that I want to keep my family safe. I want to make sure that we are all doing our part. I want to keep my students safe, their families safe. So removing the mask, being exposed to so many people on a daily basis is a little frightening. My children, I will say that the community that we live in has been very fortunate. We really haven't had a lot of cases in the 2 schools that my children are in. So whatever we're doing as a community is phenomenal. Both of my kids have stated independently that they plan on continuing to wear their masks when we go back to school on Monday. So from that perspective, I'm pleased that they're doing that. But either way, I would support whatever their choice is.
And Karen, in the statement released by TFO after Dr. Moore's announcement last week, you said, lifting the mask mandate too soon may result in further disruption to in-person learning and negative impacts on the health and safety of ETFO members, students, and their families. Ontarians deserve stability and safety, not more chaos. The government has made the argument that Ontario was the first jurisdiction in the country to require masking in schools and has been one of the last provinces to lift the masking mandates. What concerns you most about the mask mandates being lifted on Monday?
Concerns, first of all, our members, everyone wants this pandemic to be over. We want to see the beautiful faces of the students in our class, and they want to see the faces of their educators, their classroom teachers or their early childhood educators. So we're all on the same page with that. Our concern with lifting the masking is that they're lifting masking and a whole series of other precautions all at the same time. So there's no longer going to be masking. There's no longer going to be cohorting. There's no longer going to be social distancing. There's no longer going to be screening. All these measures which were put in place to help our members feel comfortable and help parents feel comfortable to maintain stability in the system is going to be removed. And these are a concern. When you have crowded classrooms, that's a concern. When we see that the population of students that we're serving, the majority of those students are not vaccinated. They can transmit the virus to our members, to our colleagues. That's a concern. We're saying let's slow it down. Let's take some time and let's just see the trends. Let's see what's happening. To remove all those safety mechanisms is a real concern. Masking was something that we had pushed. It provided an added layer of protection for our members. So with that added layer of protection removed and all the other layers, it brings a concern. We're it's currently still in Ontario. We're still scrambling for supply teachers. Boards are still using emergency supplies. So the stability that we were requiring in the system is not going to be there. We're seeing parents already talking about switching from in-person to online. We're really concerned that we need to see the trends, give an opportunity for us to be able to transition to that, to have a huge number of children now going to be eating together in a lunchroom, going to be together at assemblies, going to be together at performances, going to be on a public transit. It opens the system to a lot of instability.
Ty, I know you're a parent, and one of the things during the pandemic that kind of put my mind at ease as a parent was checking to see how many COVID cases were in schools. The province stopped doing that, but you have been tracking COVID cases in Toronto for schools for a while with the local. Why was it important for you to do that?
I think parents just want to know, right, and to take the necessary precaution. I know, depending on which neighborhood your kids go to school in, I think the risk could be dramatically different, right? We're seeing that now with the masking mandate being lifted. I think a lot of parents are concerned about, well, to what extent are the kids vaccinated, or teachers are concerned as well. To what extent are the kids vaccinated in the school where my kid goes to? And the reality is you have neighborhoods that are located right next to each other that have dramatically different vaccination rates. In Toronto, for example, two neighborhoods, one Thorncliffe Park, the other adjacent neighborhood, Leaside. Leaside has 73%, kids vaccinated. Well, Thorncliffe Park has only about 14%. So you can imagine the kind of anxiety that parents in Thorncliffe Park, might feel about kids removing their masks next week. So these things matter at a very hyper-local level, and I think parents have been relying on some of our data to really help them make some of those decisions, whether it's masking or distancing or other types of precautions, staying home, doing virtual learning, et cetera.
Well, you mentioned the different areas that people are living in the city. You wrote about how the impact of COVID looks different for students across different neighborhoods in terms of vaccine equity. Here's some of the top and bottom postal codes based on vaccination rates for children aged 5 to 11. And the data is sourced from COVAX Ontario and for 2 doses. At the very top, we've got Laird Eglinton at 73%, which is just up the road from us. Roncesvalles Dundas is at 72%. The Kingsway Bloor, southwest of Toronto, 71%. Keele and Eglinton, northwest in the city, 17%. Jane and Finch, northwest in the city, 16%. And Thorncliffe Park, Overley, which you just mentioned, is at 14%. What do those numbers indicate to us as we move forward with removing masks in schools?
Yeah, what the experts are saying is, the risk depends on to what extent we have this immunity wall to protect us, right, when the virus is still circulating in pretty significant numbers. So you're either vaccinated, that gives you some protection, hopefully fully vaccinated, or perhaps you've caught COVID before, and that offers you some protection as well. The latter, we simply don't know because we haven't been tracking real COVID cases for some time now, and the testing system isn't, at the capacity where you could do that at a on a large scale kind of basis. So what it comes down to really is vaccination rate. That's the numbers. Those are the numbers that we know with some degree of certainty. And yeah, as you saw there, huge variation in the city of Toronto. Across the province, we're seeing similar variation. You've got some neighborhoods in places like Peel or Windsor where it's very similar, like 12, 13% vaccinated. Whereas you have other neighborhoods across the province that are 80, 90% fully vaccinated for kids. So yeah, so it all depends on where the school is located.
A student-led group has called for a province-wide walkout on Monday in protest of the mandates being lifted. School boards have said that they will continue to be masking-friendly environments. Some parents have said their children will continue to mask. Is there any confusion from parents about what's the right thing to do?
I don't think so. I think parents, I think you really have to be a parent at this point, and you have to make the right decision for you and your family. Uh, the key thing is, I don't think anybody really knows what is going on behind somebody else's doors. And for people to automatically assume that it's okay for me to take my mask off, or I'm going to keep my mask on for a little while longer, that division shouldn't be there. I know it will probably be there to some extent, and it will seem awkward for some kids who are still wearing masks and some kids who have removed their masks and conversations around that. But I really feel like this is a personal decision, and that personal decision has to be respected.
Karen, it is one thing, just building on what Aya said, for people to respect each other's choices. But in those classrooms, it's not going to be the adults in those classrooms. It's going to be children, right? And my kids never miss an opportunity to remind me that they've been wearing masks for 6-7 hours a day, something that I haven't had to experience. Now, this is going to be a situation where some kids might wear masks and other children might not wear masks. Are there mixed responses from parents now that masking becomes a choice?
I think there's been a mixed response. Some parents, like us, are very concerned that the timing of this removal of masking right after the March break, a time when we normally see a higher spike in cases of COVID. So really trying to grapple why the urgency at this particular point. Why not give a little more flexibility so that parents can feel comfortable that, like you said, we're not tracking any numbers. We have no sense of what's happening with the COVID cases, really to give them that reassurance. So for those parents, masking, the delay of it's really important. For other parents, like it was mentioned before, their personal circumstances might be different. They're fed up with it. We do provide mask breaks in the schools, but they want to move on from COVID. But they might not have a child that has an immune compromise. Who's immune compromised. There might not be anyone in the home, an elder and a family member that they're living with or have to be in contact with, that impacts why they're making this personal choice. Or they just simply don't feel comfortable because they know the realities of their child's classroom. The typical elementary classroom is going to have 30 to 40 kids in that classroom who are no longer masked, no longer physically distanced, with about maybe 55% of them actually vaccinated because they're between 5 and 11. So the majority of the elementary students are not. And if they're in kindergarten, there's a large percentage who aren't eligible for vaccine and they're not masked, they're not socially distanced. All these layers together, and they're no longer cohorting. They're mixing together. They're interacting right after a break, a time when people are socially interacting together, is a reason for concern. And so I think all those factors, families are going to make their personal choices, but I think families who are connected, who've been in the school, who knows what the inside of a school actually looks like and what kids are doing and how they're sharing resources and materials and interacting and leaning and touching, have some valid concerns. And that's what we're talking about. We're talking about not just out in the community, but what does it look like navigating COVID in a classroom? We need to do that cautiously for everyone's safety.
Ty, the Children's Health Coalition, which represents children's hospitals in Ontario, said that it prefers for the mask mandate to be extended for at least 2 weeks past March break. The Education Minister, Stephen Lecce, has told school boards who wanted to keep masking in place for that period until April 15th to not do that and to follow what the province has stipulated. A school in Hamilton has made the decision to extend its mandate until April 1st, and so has the private school that Minister Lecce went to, St. Michael's, until at least April 17th. Throughout this pandemic, we heard from the government, and including Minister Lecce, that the boards could, make their own decisions based on, I think for some boards had extracurriculars at one point and others didn't. So are you surprised that boards now are not allowed to make this decision for themselves?
I'm not sure surprise is the right word. I think inconsistent is probably the right word. I think, as you said, private schools are able to do that. Universities are able to keep masks on while public schools aren't. Public schools have in the past been able to institute their own health and safety protocols beyond the government policies. So, for example, last year, the provincial mask mandate only applied for grades 4 to 12, whereas many school boards decided to additionally add the mandate for those from kindergarten to grade 3. And this year, similarly, I think the provincial mandate only covered those from grade 1 to 12, and most school boards extended that to JKSK as well. So these have been things that have been done in the past. I think right now, it feels inconsistent, I think, and that's what a lot of parents are saying, looking at this from the outside of the tight policy circles, that some of the conversations have been happening that, wait a minute, why are these decisions being made now? And they seem to be different than what school boards were able to do previously.
And we've also seen arguments that kids are low risk and unlikely to develop severe symptoms from COVID, and that the reopening of school has not resulted in significant increases in cases. Why do you still think we're not ready, Karen?
We're not ready because the layering of factors. It's not just removing one safety mechanism. It's several layers at the same time, and we talked about flexibility that's been allowed in the past, and the ability to have enhanced safety measures. So this is just an enhanced safety measure that boards want to have. They want to have that flexibility. They're dealing with the day-to-day staffing. They're dealing with their principals managing it. They're dealing with parental concerns. They're dealing with the requests of parents who are actually quite concerned and are shifting from in-person to online learning because of this. They're managing the realities of it. They're going to have to navigate how are they going to, carry out with assemblies and extracurricular, and how's the spacing removed from the classroom, how they're going to deal with sharing resources and notebooks and all these things that are supposed to return to normal. Those are our concerns. The flexibility that they had, those who are the experts, take their advice. Our members are on the front line. The school boards aren't saying let's not do and let's not lift the masking mandate. They're saying give us some time so that we can provide the level of safety, the level of concern, and they want to be able to do it right. They want students to be in until June. They want parents to feel comfortable. They want to feel comfortable, and they want to be able to have the time to plan and to put the necessary things into place. This government has not been committed to long-term planning. We've been in and out of this pandemic, online, in person, online, inconsistency, because there haven't been any long-range plans. When you hear school boards are saying they need more time, they're saying they're concerned and they want to do it right. And I'm not really sure why this government will not allow them to invest in added safety measures, which only helps the students of Ontario, helps the educators and the community. Yes, there might be low risk for kids for contracting it, but they do spread COVID. Our members do get impacted. That creates inconsistency in the system. It creates absenteeism. Parents are looking for consistency. All these factors, many people are exposed, many people are at risk. Give us the time, give us the flexibility, which you've allowed before, so that we can do our jobs and students can enjoy feeling safe and comfortable engaging with each other.
Karen said a few things that I want to follow up with you. We've been hearing a lot that kids don't get as sick from COVID or don't get COVID. You're a teacher. Adults are the ones that are teaching students in classrooms. Something that we've been talking about again during the pandemic has been the mental wellness of children. There's been a lot of mental health impacts to children, learning from home, the back and forth, as Karen mentioned. What have you observed as a parent and as a teacher with children wearing masks, and the argument that this is affecting their mental health and their ability to learn well?
It's such an interesting question. My own children have really taken on the masks, and they've been wearing them, and they've been really going through with everything that has been mandated. They also aren't really displaying. I mean, there's obviously some issues that have been going on for children, and I'm not belittling that. I have had students in the past who have had to walk away from online learning because it just wasn't working, and looking at a screen all day was very difficult for them. Fortunately, I'm not seeing that quite so much with my own children, but I did see that quite a bit with some of my students last year when we did go into the lockdown in April, and then we were on virtual school from, April until the end of the school year. Some of the students just could not be there, could not attend virtually, um, not enough devices, just the inability to sit and look at a screen, losing that connection, particularly students who required additional attention, who required additional support. That didn't work out very well for them. We did try and work around that. We did try and offer some support, and we did also provide shorter classes to some extent, just to assist our students and to assist our staff as well, because we were sitting in front of a screen and teaching all day. So it was difficult. And, we did take a few times. We did take some classes. I did do this, and some of my colleagues did do this as well, where we just had a venting session and a schmooze session instead of an actual class, where we could just, connect with the students again, because that part was really missing. But one of the things the students really said when we were on Zoom again, it was really funny. They were like, I can see you. I can actually see who you are. So we did manage to build some connections in different ways when we were on Zoom, because I could see their face, they could see my face, and we could have that interaction. And we did build on that and did take that back into the classroom. But, masks are hard for sure. Zoom is hard for sure. It's finding that balance. It's really difficult.
I don't want to put you on the spot, but you are going back to school on Monday. How are you feeling about being in front of a classroom of kids with no masks and teaching? Do you feel safe?
Well, I'm nervous. I am going to continue wearing a mask. I've actually had all of my students, it was really funny. I've had just prior to the break, my students were asking me what I was planning on doing when we returned back on Monday. And I said that I intend on wearing my mask because I am exposed to so many students over the course of the day. And my priority is to keep me safe, my family safe, and my students and their families. And I have a feeling that there will be a lot of students who will continue to wear, not a lot in my school. I don't think in my school there will be. I think most of my students will most likely take their masks off, but there will be a small minority who will still wear a mask. And I think it's important for them to see that their teacher is still wearing their mask and is still supporting them. So I'm actually very nervous about Monday going back. But I know that I'm going to maintain my mask wearing until I feel safe and comfortable. There's no numbers, there's no reporting, so who really knows what this is based on? My children are going to have made the decision to wear their masks as well. And like I said, I'll support them whatever their decision is. If they choose to take it off at some point, then that's their choice, and that's okay.
Ty, I mentioned that there are no numbers. Once upon a time, we actually knew how many cases were in schools. Now we don't. And in the adult world, we've seen videos of people pulling people's masks down. Masking has somehow become like a political issue. And I can only imagine how it's going to affect children now that it's going to be on the individual child to decide whether or not to wear a mask. How do you think this is going to affect how children play and socialize with each other?
Again, I think it depends on the school and the neighborhood. I think some neighborhoods would do just fine. I think the science table projections yesterday that came out suggest that numbers will likely go up with the dropping of some of these precautions, but not to the level where of the peak of Omicron just months ago. So some schools would do fine, but within that, I think you're going to see schools that are not going to do so fine. I think those are the schools that have traditionally had issues throughout this pandemic with high cases and low vaccination and perhaps, fewer people wearing masks. So we'll see. But, hopefully, I think in those high risk neighborhoods and schools that the parents are going to take a cautious approach and wait this out a little bit and keep their children masked as long as possible.
Do you think, though, because even now, before the mask mandates were taken away, some parents wore masks, others did not. But now when kids are seeing some of their classmates choosing not to wear masks for whatever reason, Do you see that affecting how children interact with each other?
Yeah, I think there's going to be some peer pressure, probably for sure. I mean, if you're a kid and all of your friends are unmasked, even if your parents are saying you should, I imagine that'd be very difficult, very challenging. I have 3 kids, and they all say they want to keep their masks on, but if 80% of their classmates aren't wearing masks, I don't know what decision they'll make once they're at the school. So, and likewise, I think I did an informal poll on Twitter the other day or 2 days ago, and it turned out like over 90% of people that responded, it's not scientific, but said that they keep their kids masked. And if that was to occur in some schools, the peer pressure might be the other way around, where the kids that are unmasked might feel pressure to put their mask back on. So, yeah, we just don't know yet. We'll find out, I guess, on Monday.
I'm sure we're all going to be back talking about this. For me, I don't even know what to do. I don't want to put my kids in a situation where they have to feel as if they're being othered in the classroom. I think this is something that a lot of parents will be talking about over the weekend. Thank you all for taking the time to speak to us tonight. We really do appreciate your insights.
As Ontario moves into the next phase of its public health approach to COVID-19, without mask mandates among other things, the need for personal risk assessment looks different to different people. With us for her perspective in the nation's capital, Ontario Hub's editor, Sarah Trick. Hello, Sarah.
Hi, Jan.
All right, so why is lifting mask mandates problematic for high-risk settings?
It's problematic basically because the people in high-risk settings, whether that is a hospital, a long-term care home, a home care setting, or even the bus, generally don't have a choice about being in those settings. We've heard a lot of rhetoric lately about personal responsibility and choice, and to a certain extent, I think that is valid. But if you need care in a long-term care facility, you don't have any other option but being there. If you need to go to the hospital, you don't have a choice about going to the hospital. And in that case, people should be protected, in my opinion.
When you heard about lifting public health restrictions such as masking and isolation periods, what was your personal reaction? I understand you took issue with that.
It's not so much that I think no restrictions should be lifted. It seemed to me like we were lifting a lot all at once, and each restriction each protection that is lifted places more of a disproportionate burden on those who are at higher risk of getting COVID. So if we don't have isolation requirements, people might come into someone's home and give them care while being sick. You want to say that nobody would do that, and I think most people would not do that intentionally. But in healthcare settings, there's a lot of presenteeism. Because settings are so short-staffed, there's not much sick leave. Workers in these settings don't make a lot of money. There's a lot of pressure to come in if you're feeling unwell, because otherwise people won't have care and they won't be able to get their basic needs met. So even with good intentions, somebody might end up exposing someone else to COVID-19 without these isolation requirements in place.
In your article for TVO.org, you talk about this being sort of a betrayal of disabled Ontarians. I'm curious, were you surprised by the announcement and sort of the level of restrictions that were lifted?
I do think it's important to point out that what is expiring at the end of April, if all goes well, is the emergency orders, the Reopening Ontario Act. A lot of these mask mandates and other mandates were put in place under the Reopening Ontario Act, which allowed the CMOH, the Chief Medical Officer of Health, to make these directives. And what the government is trying to do is phase those out and replace them with guidance. However, if guidance is left to individual settings, that puts the people who use these settings at more risk. And I think that lifting all of these things at once will just end up placing a disproportionate burden on people who don't have a choice, who need their basic needs met.
So the last time you were on the program, Sarah, we talked about how you were concerned about the narrative protect the vulnerable. In your recent column, you say that the subtext of last week's announcement is you're on your own for better or for worse. How are these two narratives at odds now?
I'm hearing a lot of people say if disabled people want to be protected, they should wear masks or they should ask people around them to wear masks. That's great, but the messaging around masks from the beginning of the pandemic has always been that my mask protects you and your mask protects me. So if I'm wearing a mask, I'm protecting you, but if you're not wearing a mask, you're not protecting me. There are masks that can protect the wearer. They are more expensive. These are N95 masks or equivalent. I haven't seen anything that allows disabled or high risk people to get these masks. There hasn't been any solutions provided for that. As well, if you ask an individual worker to wear a mask in your home, that's also great, but there's no guarantee that they will be able to provide these masks if their employer is not doing it for them, if it's not funded. Home care workers are already underpaid. They're not reimbursed for extra costs such as gas. None of the people that you are talking about, or that people are talking about, have the resources to do this on their own without help.
Sarah, in your column, you talk about, someone who receives home care. You have attendants who come into your home. I'm curious, what has that conversation been like? I know that some of your former attendants have actually become friends of yours, and sort of that conversation of, pay equity, but also how many different homes a lot of these tenants go to. What has that conversation been like with them and sort of the risks that they're also going into, but also someone who receives care as well on the other end?
If your agency doesn't have a mask policy, you can't ask them to wear masks, or you can, but you might not like the answer. And you don't necessarily have a choice to refuse that service because you require that to do basic things like go to the bathroom or get dressed. It's not just that you might have to move, say you're cleaning to another day. For workers, I think it's been as terrifying as for clients because we didn't know how to provide care safely or receive care safely. Especially at the beginning, we didn't know what the risks were. People in home care have been basically risking their lives every day for 2 years. They've gotten a temporary $3 wage increase. But these workers haven't been protected and they haven't been supported to the extent that they need to, and neither have their clients.
Now, Sarah, in your column, you actually mentioned that you were sort of surprised by the announcements, and it wasn't necessarily the column that you thought you were writing, because you thought you would be providing some solutions for people who live in congregate settings, Ontarians living with disabilities, about how to live in sort of an environment post mandates, post isolation requirements. What would be a better approach in this new stage when part of the population can't wait to ditch their masks and others are scared or reluctant to do so?
I would ask what's important. First of all, I am writing that column, but I do want to say it is not my job to provide solutions to this crisis. Mm-hmm. I am a journalist who writes columns sometimes. Maybe they get some readers, but I'm not in charge of any policies. I do not influence any policies. And it is not my job to decide how and what people should be protected from. People have said that they're going to protect the vulnerable, meaning disabled people or elderly people. There doesn't seem to be much in any of these strategies that allows for that to happen. If we had other things such as more available treatments, second generation vaccines, more cleaning of the air, free masks and tests provided to people who need them, I might feel a little bit more confident. But if we're just going to say this is on the vulnerable and the people that work with the vulnerable, and we're not going to give people any resources to do that, you're basically saying that these people aren't going to be protected, and it is the cost of their deaths are worth it to society so that everyone can move on.
Sarachek, I want to thank you so much for coming on the program tonight. Again, a very important topic, and if our viewers and listeners are interested, they can go to tvo.org to read your columns. Thanks again.
Thank you. It's good to see you.
Marking the 2-year anniversary since Ontario declared its first COVID-19 state of emergency, the agenda this week assessed the true global death toll, reflected on how we've all changed during the pandemic, and learned some helpful history about the coronavirus. The Agenda's Week in Review begins considering what the future with fewer restrictions looks like.
I'm hopeful that I think Canadians overall are pretty mellow people, pretty respectful. And I think I wrote a column on this just the other day saying that's what we have to do, just to respect each other's opinion. Life is not a trucker convoy. I think most people out there are quite decent with each other, understanding. I was on an elevator the other day. I had a mask on. Someone got on. They started being very Canadian, apologizing profusely, sorry, I don't have my mask. And I'm like, listen, we can all make our own choice. I think that's what we have to do in this in-between period, is just give each other some slack on this, and life goes on.
That is a very Canadian anecdote, I have to say. Yeah, and which I'm sure many people listening and watching to us right now have also experienced themselves. Dr. Uni, you mentioned pretending is not a great strategy just a moment ago. And I want to compare two countries here, not your original Switzerland, but we've seen numbers from Denmark and South Korea. Denmark dropped the mask mandates. South Korea kept its mask mandates. South Korea's numbers don't seem to be any better than Denmark's. What are we to infer from that?
So I think we really just have a bit of a different situation, just in these two places. I don't believe that you can compare it, because the social situation is different, the background immunity is different, etc. And again, as I said before, what you see in places like Denmark or Switzerland just indicate once you lift all the restrictions, you will experience a wave. We won't start from scratch here, because we have experienced an Omicron wave that we controlled relatively well. And what then happens if you lift all restrictions and go back to normal, you will need roughly, that's what we see in Iceland, in Denmark. And it probably also, depending on the situation and the social circumstances, etc., could happen in other places too, that roughly about 45% of the population will need to get infected before a wave starts to peak and we start to see numbers go down. Now, if you just reach these 45% with an extreme peak, your way to go down is a long way. And what happens is that once you're down, at the end of the wave, you have infected 90% of the population. We would like to avoid that, and this won't happen in Ontario. No. Why? We already have roughly perhaps 25 to 30% of the population now infected, and we just have to go probably another 15% or so of the population. Once these 15% are infected, we start to be not wobbly anymore, but relatively stable and continue to go down with our numbers. No? So you need to be really careful. The background immunity that we have, in various places is different. It depends on the vaccination rollout, but it also depends on how many people were actually infected. And when you look at Denmark, they had a considerable Delta wave already, which again helped with the background immunity of the population. Sadly so, but it's a fact.
Okay, in our last 5 minutes here, let's look at next steps. And Sabina, maybe you could start us off on this. We are obviously, for a whole bunch of reasons, not testing now in as widespread or as deep a way as we did when this thing started, or frankly, for that matter, even 2 or 3 months ago. You got any concerns about that as we start to take our masks off?
We're at a point where we need to invest into our infrastructure, especially into testing infrastructure, because that is what's going to guide us in terms of what we're going to do next steps. If we wait for hospitalization numbers, knowing that they're a lagging factor, it's going to be too late. We need to be proactive. We need to be using preventative measures. And the reason is because no one wants to go into another lockdown. I don't want another lockdown. You don't want another lockdown. No one wants a lockdown. And the way we can do that, the way we can actually prevent having lockdowns and other stringent measures in place is by having things like masking and testing and some of the other infrastructures in place so that we don't actually get into more restrictions. And in fact, we're able to continue to loosen things as we go along. So absolutely, I think that we have to be investing into our infrastructure in the next coming weeks.
Andre, what's your view on that? We've really de-emphasized testing a lot more recently than we did, say, 6 months ago.
Well, my concern is it's not just testing, it's what are the metrics when things go south again? You know, if numbers start spiking up, that's the problem. The fundamental problem with what's happening is I can live with restrictions being lifted. I think politics matter, that we have to respond to the public being fed up. That's all okay. But I don't like having an arbitrary date. Well, we're dropping an arbitrary date. So what's going to happen if things go bad again? Are we going to have an arbitrary date to bring back masking or vaccine passports? That's what's lacking in here is why did you do it? What's going to be the trigger to act again? That's my biggest concern. And testing is obviously a part of that. I don't think we have to do testing like we did in 2020. It's a different world, but we have to use our testing more smartly, and we have to use it as a trigger for action, whether it's positivity rate or whatever. We don't have to pay as much attention to cases, but we have to have measures, hospitalizations, positivity rate, and make them clear to the public. Here's what's going to happen if things go badly again.
Barbara, I wonder if I could start with you, because we're going to show a chart in just a second that distinguishes between what they call official COVID deaths and excess COVID deaths. So let's start with a definition. What's the difference between those two?
Yeah, so official COVID deaths are what you see in your favorite tracker, be it the Bing tracker, be it New York Times, be it the Our World in Data. These are deaths that are reported by Ministry of Health in different countries, official statistics departments. Different countries have different convention about who releases these numbers. So these are usually following and attached to a positive SARS-CoV-2 test, and sometimes there is a lag between reporting of deaths. But then the excess deaths are defined as the net difference between the total all-cause mortality that happened during the pandemic and the number that would have been expected had we followed past mortality trends. This is sort of a global summative measure of what happened to human mortality during the pandemic period. So the official deaths are COVID-related deaths that are mapped by released officially, and the excess deaths, it's sort of like a total toll of the pandemic.
Sandra, come on in here and say why you believe it's important to distinguish the difference between those two categories.
Yeah, sure. So I think one thing that was learned very early on is that COVID-19 cases do not count COVID-19 infections, and COVID-19 deaths do not count all who die because of the pandemic. And so if you want an accurate picture of what the pandemic actually has looked like, you need to go to some other number, and that number is excess deaths. And so what we have done here at The Economist is that we have constructed a model to estimate excess deaths in all countries, and in that way obtain an accurate measure of the pandemic's true death toll. And we update this every morning.
Is that to say, Sandra, that you do not believe the quote-unquote official COVID death number is accurate enough?
What I believe is that excess deaths is both theoretically and practically superior as a measure of the pandemic's death toll. And I say that meaning that practically, it is unfortunately the case that in poor countries, testing is very limited. And that means that you will only capture a very small number of those who die of COVID-19 in the official death toll. Even in very rich countries, you see a difference between the number of people captured in excess death tolls and the number of people in the official death toll. Now, conceptually, there's also this difference, which is that excess death also captures things like overburdened hospitals and people not seeking healthcare, which is part of the pandemic and should be counted as such.
Okay, understood. Tara, let me bring you in here at this point, and let's focus on the Canadian situation. And I wonder, because I know we've had great debates, even on this program, about what constitutes a death from COVID-19 versus with COVID-19, all of that. In your judgment, what comprises a COVID-19 death?
Well, this is a difficult question to answer because a lot of people may die prematurely because, for example, say they have an underlying health condition and COVID-19 infection accelerates their death. So the two together work together to make the person die sooner than they would have normally. So it's actually very hard to distinguish between deaths with and of COVID. And what you really need to do is determine that statistically almost after the fact. So if you report all of your deaths as recommended by the World Health Organization, the Public Health Agency of Canada, then you would report all deaths. Sorry, my cat's going to join. You would go away, kitty.
This will not be the first time that a pet tried to have a cameo on this program, so it's okay.
No, I know. So you could determine that more readily after the fact because you can look at what percentage of, if you completely report your COVID deaths, you can look at what percentage of them likely would have occurred in the particular age group of people, how many of them would have died of other causes. But trying to do it at the time is very challenging to do and can lead to a lot of underreporting of COVID deaths. And I think we're going to see that with the excess mortality. Unfortunately, in Canada, death reporting for excess mortality is so delayed compared to most OECD countries that we still really won't know what's happened in the Omicron wave, for example, for another year or so.
Does it feel to you like this thing is now, if not over, at least coming to an end?
Yes and no. We're into March break in Ontario, of course, and the vast majority of students are away from school, and many of them will be traveling either alone or with their parents, and then coming back to school where no mask is going to be required. I hate to get too political here, but I just wonder if it's a little too much too soon to come into this situation, and should we not wait a little bit? I understand the political science of some decisions, and I also hear and read and understand the scientific discussions about these kinds of things. I will continue to wear a mask. I was a little not reluctant to wear a mask, but can be not the most comfortable thing in the world to wear for a long period of time. But it's going to be a long time for me to feel comfortable, Steve, where I can go into a public place and not have a mask and not to carry hand sanitizer, which has become sort of something you carry in your pocket now along with your wallet. So for me, it's a little too much too soon. I wish we could wait a bit longer, but I understand because I have friends, for example, in one case, a friend is not even vaccinated. And that has meant, of course, that we've not seen these people, my wife and I, and they've not seen us, and there's always been kind of a distance, and it has really strained, relationships, I think, where you are part of the vaccinated group, and then there's the unvaccinated group in my areas. You have to stay away from people. I miss the interaction with people, not just family. I sometimes worry, will my 3-year-old granddaughter remember Grandpa Bob? And all the food I brought to them during the pandemic became my new career as a chef doing takeout to help the family. So those are the things I miss. Just sitting around a table with perhaps a beverage, as now sadly the late Mr. Davis would have suggested, and talking about what Steve Paikin had done or said on the agenda the night before. I miss that. I miss that social interaction. I want it back, but I also want to do it when everybody can be safe and not create problems for anyone, anywhere, at any time.
Hang on a sec here, Robert. You and I worked together 35 years ago, and one of the first things I was told at CBC Toronto was you don't ever call Robert Fisher Bob. He's always Robert. Are you telling me your granddaughter's allowed to call you Bob?
Oh yeah, that's part of the deal. That's part of the deal. My catering service is often referred to as Grandpa Bob's cooking, soups and cookies and chicken things and so forth. But there's a few people that call me Bob, but I answer to anything, actually, Steve.
Okay, good enough. Quam, aside from my shtick there, Robert actually did make a very important point, which is to say that he's concerned that some of the decisions being made these days are not for epidemiological scientific reasons, but rather for political scientific reasons, as if the political calendar had more to say with what we're about to do, than epidemiology or good science. What do you think on that?
Well, I think Robert's right to a certain extent, but I also think that there's we did a lecture recently which was all about Star Trek, and it was talking about the relationship between Captain Kirk and Spock. And Captain Kirk was sort of values, ideals, and also society. And Spock was supposed to be about science and making rational scientific arguments. And the question I was asking was, who does society want to drive the democratic bus, Spock or Jim? And though we all tend towards thinking that it should be a rational Spock type argument, we tend to choose Jim in the end normally. And Spock gives advice, and Spock gives good advice, but Jim drives the bus. And so, yes, we are in a situation where we have the death rate from COVID, which is as high now as it was a year ago. And yet some of the political calculus is that we can remove mandates. Now, remember, the advice from public health is, as Robert said, continue to protect yourself, keep your mask on in high-risk areas, keep washing your hands, get tested if you're concerned, and get yourself vaccinated. But the mandates have gone.
SARS took us by surprise in 2003, but you think it shouldn't have, right? Was this not its first appearance?
Yeah, so at the time when SARS emerged, there were 2 known coronaviruses that could infect humans, and as you read in that excerpt, they both caused just common colds. It seemed like a very stable family, a family that didn't change much, and that, even when SARS emerged, which we thought of as the first, pathogenic human coronavirus, it was understood as kind of just an aberration of nature, just something that was entirely a coincidence, and not some kind of comment or reflection on the ability of the family to jump from species to species and to become dangerous. Now, in the wake of SARS, there was some really interesting work done by scientists using something called molecular clock analysis, which is basically a way to go through the speed of mutations that viruses produce and kind of follow the thread of mutations back to the moment when a particular viral strain first branched off from its closest relative. And using this technique, coronavirologists went back and discovered that there was one of these known coronaviruses that now, just only cause common colds, had actually emerged in the 1890s. And they pinpointed the date to, the end of between 1889 and 1890. Now, what's remarkable about that moment in time is that it's exactly when something called the Russian flu pandemic swept across the globe. And this was a pandemic that killed 1 million people. And as its name suggests, it was commonly understood to be a flu. And it was only much later, after the advent of SARS, that it seems like that was potentially actually a coronavirus pandemic in disguise.
How shocking a revelation was this to you and your colleagues?
I think it's pretty shocking, and the further back you go with molecular clock analysis, you understand that the history of this viral family isn't counted in thousands of years or 10,000s of years as it was commonly believed. It actually potentially goes back as many as 300 million years, and that's a long time, and that's far, far before our species ever walked the earth. And so that suggests that, rather than being something entirely new, coronaviruses might actually predate our own species and that we're, living in a coronavirus world, and we just happen to show up in it.
You mentioned Russia a moment ago, 1 million deaths there. Take us back 1,000 years to China. What did you find there?
Yeah, so it's again, using this molecular clock analysis. There was another coronavirus strain called NL63 that nowadays again just causes a common cold. But using this molecular clock analysis, it was identified that it first emerged around 1,000 years ago. And the further back in time you get with molecular clock analysis, the fuzzier the estimates are. What was going on in the 11th century, which is fascinating, is that China had emerged from hundreds of years of chaos into this dynasty called the Northern Song, which was sort of a high point of Chinese culture, economy, sophistication, and international trading. And it was also a point in time when 80 years of extreme epidemics racked the country. And so I went back and I looked at, extant notes from physicians at the time, from policies that were recorded by the Chinese court, and discovered that there were a number of these epidemics that caused symptoms very similar to what a coronavirus is known to cause. And so, it's far, far back in time. We will never know for sure whether it was a coronavirus that caused this wave of decades of epidemics. But it certainly seems like it could have been the case. And it's also sort of, I would say, a cautionary tale in what happens to societies when epidemics are able to just run unchecked.
That's just some of what we covered this week. You can find the full conversations on our website, tvo.org, our YouTube channel at youtube.com/theagenda, or our Twitter feed, twitter.com/theagenda. And that's all for this Friday, March 18th, 2022. Monday, NATO, Ukraine, and lessons for Canada's military role in the world going forward. I'm Nam Kiunika. Thank you for watching TVO and for joining us online at tvo.org. Have a great weekend, and Steve will see you on Monday.
The Agenda with Steve Paikin is made possible through generous philanthropic contributions from viewers like you. Thank you for supporting TVO's journalism. Ontario Hubs are made possible by the Barry and Laurie Green Family Charitable Trust and Goldie Feldman.